Welcome to The Doctor Will Hear You Now, a podcast featuring our physicians and other healthcare providers telling their stories, sharing glimpses into their daily work and mission, and showing what it means to practice medicine just a little bit differently. Healing you means hearing you, so let's talk. I'm Ben.
And I'm Lexi, and today we're joined by Dr. Aimee Hymel, board-certified and fellowship-trained general and bariatric surgery specialist with Our Lady of Lourdes Health in Lafayette. Dr. Hymel is dedicated to building strong and lasting relationships with patients with special interests and motivating them to live their best lives. Well, Ben, I think we learned so much from our conversation with Dr. Hymel that I'm blown away by just her knowledge and just really her passion for her patients living what she called healthful lives. And I think listeners, I'm really excited for you to listen to this or watch it because really she debunked a lot of myths and talked through a lot of misconceptions. And I think my biggest takeaway, or really what drew me in, is just her passion and how inspired she is for advocating for her patients and really having this seen as a medical condition so that insurances can cover it and so that her patients have access to all of the treatments that are going to help enable them to live healthy lives. And I thought that was just, again, really inspiring and great to see that how passionate she is about everyone that she cares for. What about you, Ben?
Yeah, so, obviously this topic today is all about bariatric surgery, but what we learned is that there's just so much more involved in that process. The doctor is going to be with you and the team is going to be with you every step of that process, meeting with you for weeks before and helping you prepare and get to the right space before that surgery, but also figuring out if this even is the right treatment for you. She mentions that during those conversations, you might go a different route based on your consultation with the doctor. And afterwards, they're supporting you through the changes in your body, developing better relationships with food and new eating habits, and just kind of developing a long-term healthy outcome for yourself. So it was a great conversation.
It definitely was. We're excited to dive in and share that conversation with you. Welcome, Dr. Hymel. Thank you so much for joining us. We're so excited to have you on the podcast today.
Good morning. Thank you for having me.
Of course. We're excited to talk to you about just all of the surgical solutions for weight loss. But before we dive in, I'm interested to learn just a little bit more about you and your work for Our Lady of Lourdes Health. Will you tell us about your background and how you came to your surgical specialty?
Sure. I'm born and raised from Baton Rouge, Louisiana. I did undergraduate studies at LSU in Baton Rouge. I majored in biology, but I did minor in nutritional sciences at that time. So early on, this was a passion, something that I was interested in, and also a topic that I don't believe there's enough education in our system on the topic currently. So after undergraduate studies, I went to medical school in New Orleans, again, LSU. And after that, I did a general surgery residency, again with LSU. It was based in New Orleans, but we did our training in New Orleans, Baton Rouge, and Lafayette, which is actually when I first came to know Lafayette at all. I came out here for the first time during my surgery training, and I also ended up meeting who is now my husband here in Lafayette as well. After I finished my general surgery training, I did my 1-year fellowship in bariatric surgery, and that was in Annapolis, Maryland. And then I came home, to my new home in Lafayette to practice with Our Lady of Lourdes, and that was almost 4 years ago.
Wow, that's awesome. Lafayette captured your heart, it sounds like.
That's right.
Well, so the topic that we want to talk about today is all about bariatric surgery. So can you give us maybe a brief overview of what's involved in bariatric surgery and who might be a candidate for it?
Sure. So bariatric surgery is a few different types of surgery, and the point of those surgeries is to aid patients with losing weight to help optimize their health and improve medical conditions that are associated with being morbidly obese.
Tell me a little bit more about the morbidly obese and that phrase. Is that a proper medical term? Tell me more about that and indications for that.
Sure, and that's a very good question, Lexi. So, morbid obesity is a medical diagnosis. It is a diagnosis given to patients once they reach a certain weight in comparison to their height, and when they have medical problems that are associated with being overweight. What we have found is that there is a certain weight associated with your height that puts you at increased risk for medical problems due specifically to your weight. Patients who reach that threshold then become candidates for bariatric surgery. And the majority of patients who reach that threshold, their insurance will actually pay and cover the majority of the costs associated with bariatric surgery.
Yeah, I think thanks for talking through that, because I think that that term sounds, or it just, in how it's become culturalized, it sounds scary and mean, right? And so I know that's hard to hear as a patient, right? But it really does open the doors for things that could help you and your health.
Absolutely. And it's actually something that bariatric surgeons and medical doctors who also treat morbidly obese patients, we are actively striving to fight, is this negative connotation around calling patients morbidly obese. But what it truly means is that it's a medical diagnosis that deserves treatment in and of itself. And when we can get society to understand that, and more importantly, insurance companies to understand that, then medications and surgical treatments can become available to all patients who can benefit from them.
Well, so how does a surgical solution like bariatric surgery affect weight loss and the overall health of a patient?
Good question. So bariatric surgery is performed minimally invasively. This means with small incisions across the abdomen. It is a major abdominal procedure. It does require general anesthesia. Therefore, part of the preoperative process, or the process before having surgery, is determining the patient's other medical problems and medically optimizing them to decrease the chances of having any type of complication from the surgery. The surgery in and of itself, there are a few different options for the type of surgery a patient can receive, and it is all geared specifically to what is best for that patient. But they all involve some form of alteration of the GI tract, the gastrointestinal tract, the organ inside our body that allows us to digest food. And the result of these alterations to the gastrointestinal tract is a fairly rapid amount of weight loss, usually in the first year after surgery, also with the correction or resolution of many of those medical problems that are associated with being morbidly obese. Again, with the majority of the results being seen within the first year after surgery.
There's a couple of things. I think you mentioned a lot of interesting points I want to dive into there with that. And I think the first one is, what are, I guess, some of the other health complications that you see in patients who are morbidly obese? Is it cholesterol? Is it diabetes? What are some of those things that may cause concerns or red flags?
Sure. And this isn't an extensive list, but some of the more common medical problems that are associated with being morbidly obese are high blood pressure, high cholesterol, diabetes, type 2, of course, obstructive sleep apnea, but also some other things that patients may not really think are due to their weight, and that is depression, osteoarthritis or arthritis of your joints, chronic pain, which again, these aren't necessarily medical diagnoses, but things that patients tend to see improvement in after the surgery, which is things like chronic pain and other psychological issues as well.
Interesting. Yeah, I think wouldn't have put those together could be caused, could cause that could cause other health issues, right?
Right.
So I think that's helpful to know, and that if patients are experiencing that, it's something to talk to your doctor about. Mm-hmm. And then the other part of kind of what you talked about is the types. There's different types of bariatric surgeries available. How do they differ from each other? And I guess what are the different types, and what could be different about what someone could consider for each one?
To not go into too much anatomical detail just to bore us and confuse everyone, but essentially we have 3 different surgical options. Essentially, as you move up the rung, the surgeries become more complex with slightly more risk of complications, but also with greater amounts of weight loss usually being achieved. So on average, the first option, which most people know, the sleeve gastrectomy, Right now, our literature quotes about an average weight loss after surgery of about 80 pounds. This is average, which means patients lose more, patients lose less, but that is the average that our literature shows us right now. For some patients, 80 pounds, while that would certainly benefit their health, it would not necessarily get them to that weight that truly allows them to live an optimally healthy life. And this is when we may consider a different surgical option, one of which is the gastric bypass, and another is the duodenal switch. And again, the anatomy is different. The changes we're making to the GI tract are different. And as you move up that rung, like I said, your chances of complications are higher, but also your ultimate weight loss is usually higher as well.
Well, so like you mentioned, with any of these surgeries, it's in that first year that you're going to be seeing the most dramatic weight loss. Let's talk about, I guess, some of the other benefits that might happen, some of the chronic conditions that you listed earlier. How do those fall into that year afterward?
Absolutely. So the first year after surgery is when we see the most rapid and most dramatic weight loss after surgery. This is also when we see improvement in many of the patient's medical problems that are associated with being morbidly obese. It's usually around the 1 year mark where we see the maximal amount of weight loss, although patients can continue to lose weight after the 1 year mark. It's not a magic time frame. But generally, we see around then patients reaching ultimately near their goal weight, as well as improvement in many of their medical problems. And then they go on living the new lifestyle with all of the new things that they have learned around healthy food choices and healthy activity for their body, able to maintain that weight loss, as well as that improvement in their health status, ultimately for as long as they want.
I like the way that you say that it kind of empowers them to move on to a more healthful life. And I think, what would you say to patients who maybe feel a lot of shame or even just disappointment in themselves or embarrassment? Is that something you kind of help those patients work through even past surgery? I mean, I think it's a really difficult thing to overcome, and I'm glad that there's resources that can help people be healthy and happy. And that's really what we want at the end of the day, right? Is to live a happy, healthy life. And so are there things that you do to kind of help your patients work through some of that?
Shame, embarrassment, frustration, these are very, very common feelings for patients to come to my office with initially, because 99% of the patients that I ultimately operate on have been struggling with their weight for years, not for a few months. They didn't just sort of let themselves go for a few months. These are patients who have been struggling and fighting and working at this for years. You know, yo-yo dieting and diet culture is so well established at this point. And the majority of patients, once they decide, I'm ready for this change, I want to do something about this, they have frustration and maybe even embarrassment from their lack of success in the past in making those successful lifestyle changes. The important thing about the process of bariatric surgery is that it's so much more than come to my office and have surgery. It's months of preparation. It's meeting with a registered dietitian as often as you meet with me, the surgeon. It's having medical clearances. It's having laboratory work done, x-rays done, psychological evaluation, all of these things to prepare the patient for the ultimate life changes that this process is going to bring about.
It's so great to hear that it's not just it's surgery and you're done. You have this kind of coach with you to empower you to move through what's this next phase of your life, right? And without the frustration and the tools to help there. I think you mentioned a little bit about lifestyle changes after, and it sounded like there are probably some lifestyle changes that are necessary before surgery. You said to make sure they're medically healthy and ready to have a successful surgery. Can you talk a little bit about what happens before you go into surgery and what that process looks like?
Sure. The pre-op process, or the period of time between meeting me and then having surgery, is very different for bariatric surgery than I think any other type of surgery. It usually takes, I would say on average, 3 to 4 months between the day you meet me and having surgery. But again, that is completely specialized to each patient's needs. And it is a combination of a few different things that we're achieving during that time. One of the most important factors is making sure the patient is safe and as medically optimized as they can be before undergoing an elective surgery. I always tell my patients, if you have a heart attack on my table, well, it's not really going to help if you lose 20 pounds after surgery, right? And so we have the luxury of time with bariatric surgery. I'm not rushing you to the OR. I'm making you as healthy and as safe as possible before undergoing that surgery. So that's one part of the process. And that is completely patient specific, depending on their medical problems, their age, and all sorts of other things. The other part of the pre-op process, which is equally as important, maybe more so, is that the patients begin their education and working on their lifestyle modifications that are crucial to their success after the surgery. And that is being educated on making healthful choices when it comes to the things they eat and moving their body more on a regular basis. And like I said, this is also very patient specific. There's no one size meets all. My patients come to me and say, just write me a meal plan. Just tell me what to do in the gym. And I can't do that because every patient has different needs when it comes to what they eat and how they move their body. But we educate you and give you the tools to make those decisions for yourself.
You have to do what's sustainable, right? Over a long period of time for yourself, not just stick to a plan because someone says it's what you should do, right?
The majority of patients who come see me have tried that before. And if they're in this, then obviously it didn't work.
Talking a little bit more about what happens after the surgery, you talked about kind of those lifestyle changes that have to be put into play. And I'd imagine some of it is breaking habits too, that might have, stress of life or things like that. They might have turned to food in the past to sort of fill that gap. I wonder if you could talk a little bit about the effects on the psyche in a way after surgery and how looking at your body and how it's changed or how rapidly it's changed, like what kind of resources are you offering them to kind of deal with that rapid change?
That's also a very common thing that we discuss before surgery and after. And I usually tell them, let's say it's a 45-year-old coming to see me. I say, you've been eating a certain way for 45 years. You're not going to change it overnight. You're not going to change it tomorrow. You're not going to change it in a week. And that is why all of these things we start working on in day one, because habits do not change on a timeline of weeks. They change on a timeline of months to years. And the same thing goes for the changes after surgery. While they are more rapid after surgery, then we have proven, of course, that patients lose weight more rapidly after bariatric surgery than just with standard diet and exercise alone. It does take time to adjust mentally to their new way of eating and how it feels when they eat and thoughts around eating, thinking about things like protein and portion sizes and things like this that patients have never thought about before. And that's why the follow-up, as in the schedule with which patients come back to my office to see me after surgery, is also completely different for bariatric surgery than any other at least general surgery, since that's what I practice, I know. And the follow-up schedule, while again, different for every patient, is at least 4 times in the first year and annually after that. So again, just like I don't meet you and take you to the operating room, I don't operate on you and then kick you out the door and say, good luck, have fun, good life. Because the follow-up process is almost just as important as that pre-op education process. And having the appropriate support and follow-up is critical to success with bariatric surgery.
It's nice to know that it's not you have surgery and then you go on your merry way without any support or help. I'm sure that's a really nice comfort to your patients to know that you're still there for them beyond just the operating table.
Mm-hmm. Absolutely.
So I'm going to switch gears a little bit. And I think this is a hot topic, and I'm sure you get this question a lot just with your patients and interactions. We know weight loss medications are soaring in popularity and interest. And that made us curious that if there are still instances where bariatric surgery would still be a strong consideration outside of those medications. And if there's instances where a person may use both to achieve the health goals they're looking for?
Another very good question, Lexi, and something that I think patients have a big misconception about. And it is that weight loss medications have always been and will continue to be very important to the bariatric surgery process. We use them both preoperatively and postoperatively when they're appropriate. They're not appropriate for every patient, but they're an amazing tool and adjunct to this process. Another thing that I don't think patients quite understand is almost that each patient's experience when they come through this program is different. And so I feel that there's some negative connotation. Patients are worried that if they even call us on the phone or make that first appointment, then it's almost like they're sucked in and they're stuck and they're going to have weight loss surgery. And what if there was a better option like the new injectables, GLP-1 agonists and things like that? But the way that it is in actuality is each patient is evaluated the first time I see them and every time I meet with them, which is every 4 weeks, until we decide together, me and that patient, that surgery is the right thing for them at that time. And the plan changes during that process. It changes for every patient. Some patients come in thinking they want this surgery, and after meeting with me, maybe the plan changes to a different surgery. I have had plenty of patients come in planning on having bariatric surgery, and just the pre-op process, education, and maybe the use of some medications, they find that they're able to lose the weight without surgery. And I think that's fantastic every time a patient does not have to undergo the risk of surgery and still achieve their goals in health. So I do think that's a common misconception that by seeing a bariatric surgeon, they wouldn't be offered all these other options to get themselves healthy. At the end of the day, my goal is for my patients to be healthy, however we get there.
Thanks for debunking that, because I think that's likely what most people know and think is that's how it goes. And so that's good to hear that it's a process and that you help them through it.
Obviously, all three of us are here in South Louisiana. And we know that kind of culture might play a role in our relationship with food. We love good food. We love to celebrate. I'm curious what you see as the role our culture plays in the number of patients that you might see or what they're struggling with and the habits that they might have to break.
That's a great question. Yes, we have such a unique patient population here. We have such a unique culture. We have very unique food. And absolutely, I do think it plays a role in my practice and the patients that I see. And that kind of dives back into what I mentioned before about each patient. It's about education, not about prescribing a meal plan. And patients have to learn how to evaluate their food, what is in food, what is in the food that they're eating every day and putting inside their body. And they make the decision for themselves, what are the right things and the right ratios and the right amount of foods that I want to be eating. And it doesn't mean that my post-op bariatric patients never eat rice and gravy again, because believe me, they do. But it's about, and rice and gravy and Cajun food can absolutely be a part of a healthy diet. It is all about the amounts of foods and how often we eat foods and what our overall diet looks like, not one specific type of food that we eat. And that, again, it's a huge part of the education. I know I tell my patients all the time, they think they're coming to see me as a bariatric surgeon. They come to see me as a bariatric surgeon. They think the most important thing that's going to happen to them is the surgery. And that's fine if they think that. The most important thing I know is their education. That is what's going to allow them to be healthy long term.
Yeah, definitely. And I like what you said. It's not that you can never not have beignets again, right? Or etouffee or all of the yummy fried food. It's just in watching in moderation, right?
Absolutely. I tell them your health is made up of what you do every single day, not what you do every now and then. And our habits are what we do every single day on a regular basis, not what we do every now and then.
I know you kind of debunked a little bit of a myth already, but I wanted to go back to that. Are there any other misconceptions that you want to clear up about bariatric surgery or weight loss or any of that may be surprising or lesser known facts that our listeners would be not aware of or interested in learning?
I do think that a lot of patients don't realize that the majority of insurance companies now and insurance policies will pay for bariatric surgery. I think that in the past it had been more difficult. One of the things as a bariatric surgeon that I'm always doing is advocating for more coverage for bariatrics. And very slowly in this state, we are slowly gaining some ground in different insurance companies and different coverage for patients. So even if patients had maybe looked into it 5 years ago or 10 years ago and they weren't a candidate or their insurance didn't cover it, it is so easy to just check. You can either call your insurance company or you can just call my office. I have a patient coordinator whose one job is to help patients find out if they have insurance coverage, what it is, if it's appropriate, if it's something they're interested in, and then getting them set up for an evaluation if that's something that they want to proceed with. And so I would encourage patients, if it's something they've ever thought about, it doesn't hurt to ask and find out what your options are.
Well, can you talk a little bit about, I guess, maybe the future of bariatric surgery? Are there advancements, technologies, new ways of doing these procedures that you might be excited about and kind of want to share with us?
Bariatric surgery is a relatively young surgical field, and we have changed drastically in the last 20 years. And I see that we will, I'm sure, continue to evolve and learn and become a better specialty with time. Currently, though, absolutely the thing I'm most excited about is the advancements in the medications, because I do believe that as we become smarter in medicine and we begin to actually focus on morbid obesity as a disease and treating it, that we can actually start to make headway and permanent headway in making patients not just a little thinner, not just have a little less body fat, but truly take them from unhealthy to healthy and have it last. And I think that future involves bariatric surgery, it involves GLP-1 agonists, and any other developments that we may see.
And I mean, you kind of said it too. You're working on the mindset of the patient and changing their way of doing things, but you're also kind of looking at the mindset of society too, and how it views morbid obesity and whether it's something that's worth bariatric surgery and other treatments like that.
Absolutely. The barrier to treatment when morbid obesity is not viewed as a disease really ties our hands when you can't prescribe the medications you want or perform the surgeries you want if insurance companies don't see it as a disease and then won't approve it. And so those barriers slowly are coming down, and that is very exciting for the future of bariatric surgery and weight loss medicine.
That's really exciting and something that's been needed for a long time.
I agree.
So I have one question, and I know it wasn't on our original question list, but it popped into my head I think a lot of our listeners and watchers are women. And so I'm curious let's say if there is someone who is interested in bariatric surgery, but maybe hasn't had children yet, wants to have children. Is that something they should consider an option before having kids? Wait till they have kids and then do it after? What's kind of the recommendation there? Is it it doesn't matter either way? I'm just curious.
It's actually a very, very good question. And it is, of course, as I've been saying, patient dependent. But bariatric surgery before pregnancy can be a good tool for patients that are struggling with fertility and other diagnoses like things like PCOS. An important thing to understand is that for the first year after surgery, it is incredibly important that the patient does not get pregnant. While the patient is having rapid weight loss, you don't want to be trying to grow a baby under those circumstances. So besides that first year after surgery, though, pregnancy is perfectly safe and just as safe in a bariatric patient. And in some patients, it can be actually much safer because morbid obesity does make patients higher risk for many complications, both while pregnant and during delivery. So absolutely, for some patients, it could be a good option before they get pregnant. And for other patients, it may be a better option after they're done with pregnancy. And again, that would be up to a great conversation to start with their OB gynecologist. But also, again, It never hurts. If you're interested, if you think it might be an option, to call, see what your options are, even schedule an evaluation and see what your options are. And if the best plan for you is, hey, go have as many babies as you want and come back and see me afterwards, I think that's a great plan. And I plan on still being here when you're done having babies.
That's great. I'm glad you talked through that, because I could see how some people could say, well, I'll wait till after and my body will change anyway, but it could be even healthier for the baby before, just depending on the circumstances and the patient. Yeah. Well, we always like to ask this fun question to our guests. And we are a listening podcast. We're the health system that listens. And so what are you listening to lately? It could be fun things like podcasts, music, or something professional or personal, but we always are interested in what our providers are listening to, what's on their playlist.
So I have recently become a podcast girly, which I never was before. But I actually have a few that I rotate between. They're kind of boring. They're mostly kind of how I get my news and some financial information. I feel like since I've started practicing in Lafayette, I guess I'm not as fun as I used to be. But I listen to financial podcasts and I listen to news podcasts the most.
You're still fun, Dr. Hymel. And I think that is, when we're on the go so much, that is how you have to get your news. You can't always sit down and read or, scroll your phone, and listening while you're multitasking is a great way to get that information for sure.
I also have a 9-month-old son at home, my first. And so, no time for TV in the evenings or anything like that. So podcasts in the car, that's where I get my information.
Yes, you stay busy.
Right.
Well, before we wrap up, I guess, is there anything else you'd want to share with us that we might not have covered, or that you want our listeners and viewers to understand about bariatric surgery?
I just want to reiterate what I spoke about before, which is this is an option for many patients that don't realize it. And so if it's something that you've ever thought about, if you think there's any chance that you might be interested in weight loss surgery, medication weight loss, or just support with your weight loss journey, these are all 3 different options that are offered by our bariatric surgery clinic here with Our Lady of Lourdes. And so what I would encourage patients to do is just to reach out and see if anything that we offer is appropriate for them.
Well, listeners, thanks for tuning in. And Dr. Hymel, thank you so much for joining us. It was so great to hear from you and hear your expertise and advice on this, and just great to learn more about bariatric surgery and all of the different options that are available to patients.
Absolutely. Thank you for having me.
Listeners, thanks for tuning in. We'll have everything Dr. Hymel mentioned and other helpful resources linked in the show notes. We'll be back soon with more episodes of The Doctor Will Hear You Now, a podcast from Franciscan Missionaries of Our Lady Health System.
And if you have ideas for topics you'd like to hear on the show, email us at podcast@fmolhs.org. Thanks for listening.